Hi, my name is Olivia Vicena, and this final presentation covers what I have learned in my ECCE 2201 Exceptionalities course. Let's begin by talking about my two competency areas. The first one I chose is number 6, explore assistive technology and their use in inclusive settings. I have learned that assistive technology comes in all shapes and sizes. According to the severity level of a child's disability, she may need more or less help from assistive technology. There are also many different types of assistive technology, and each one serves a specific function. In inclusive settings, they help the child to function and participate better. They do this by helping the child walk, talk, read, and many more. The second competency area I chose was number 26. Describe the major categories of speech language disorders. I have learned that there are many different categories that encompass speech language. Communication disorders are one of them, which happens when the child is unable to receive and process information correctly. One type of speech disorder, called cleft palate, is a congenital disorder that occurs when the roof of the mouth has not closed completely. This can be achieved by surgery and is usually done within the first 18 months of life. There are also other speech language disorders, such as articulation processing, voice, and fluency disorders. I will use this knowledge gained in this course to support children to the best of my ability. Where they have strengths and challenges, I will focus and build upon them. I will also support them by intervening early when I suspect a child has special needs. Assistive technology will be used, which depends on the child's severity level. Based on that level, accommodation and modifications will be put into place. To advocate for inclusive practices, I would have a presentation on the different types of special needs and what they entail. I would also work with other special needs teachers and the child's family to create a support system and supportive environment. Laws and regulations. Under Part B of IDEA, it talks about special education for students with disabilities from ages 3 to 21. They must be identified and evaluated to determine who is eligible for special needs and other related services. The eligible students must receive an individualized education plan. This is developed by a team of professionals. The IEP lists out the accommodations and modifications, as well as services a child will receive. Part C of IDEA serves children from birth through age 2 with disabilities or developmental delays. Under Part C, the family is given intervention services. Each family receives an IFSP, which outlines the family's concerns and priorities for their child. The first type of disability is vision impairment, which is where a child has low eyesight or complete vision loss. Brain damage is the main cause of this, or it can be caused by optical nerve damage. There are treatments available to improve this, such as wearing glasses. For example, the stronger the prescription, the more severe the impairment is. However, identifying a child early puts them on the fast track for future success. An assistive technology device I put is a screen magnifier. I would use curtains or blinds to block the sun and reduce the amount of light in the room to adapt students with visual impairments. An inclusive classroom activity that I would implement would be to use a big interactive board. The children can play educational games on the board, such as alphabet games. The board will repeat back the letter that she touched so that the child can hear it instead of see it. Down syndrome is a genetic condition that results from an extra copy of chromosome 21. It can affect how the brain grows and develops. Down syndrome can affect anyone from children to adults and is very common. It differs on the aspects of the child, such as physical, cognitive, and behavioral. The areas affected differ from person to person depending on the level of this condition. An assistive technology device I put are speech tablets. An adaptation I would make is to provide visual aids and picture cards to the students. An inclusive classroom activity that I would do to support children would be to play with Play-Doh. Each child receives a color of Play-Doh to play and interact with. They can make whatever they want, which helps with their physical and sensory development. The third type of disability is cerebral palsy. Cerebral palsy is a condition that affects a person's movement and coordination, making it harder to perform everyday activities. It is mainly caused by brain damage that occurs before, during, or after birth. It ranges in level from mild to severe. A person with a mild case may require little to no assistive technology help, whereas a person with a severe case may need a lot of help. With this disability as well, early intervention can help that child succeed in the future. An assistive technology device that I put is a CP walker. One adaptation I would make is to provide adequate space and opportunities for the students to move around. An inclusive classroom activity that I would do to support children is to do knob puzzles, where the teacher takes all the pieces out of the puzzle and the students have to put them back in to their correct places. This will help with their motor skills and coordination. This concludes my presentation, and these are my references. Please feel free to pause and review them.